Now today I'm talking about the human papilloma virus. It was requested from me to talk about it in English, so I will just talk about it in English this time. Actually, the infection of or the genital warts are caused by the human papilloma virus. It's a type of viruses that affects the epidermis, okay, of the skin. And also the mucus affects the mucous membrane. So we have about 100 types of human papilloma virus actually. 35 of them are related to genital wart. Some of them actually are neoplastic or pre-neoplastic, and some of them are not. Now, after the infection, what happens? There is a latency period, about from 3 to 9 months. This latency period, after that the infection happens. So where does the infection occur? It occurs in multiple places. It can occur in the penis, in the vulva, in the vagina, in the cervix, and sometimes perineum or perianal skin. Actually, it can also happen outside these places as oropharynx, larynx, and trachea as well. And very rarely it can happen in the extremities, like human papilloma virus 6. It can happen in other places, which is uncommon actually. So the etiology of the viral warts in the genital area, or what is called of genital warts, is human papilloma viruses. As we said, 6 and 11 are the most commonly isolated, and also there is more than 60 types which are also can cause the condyloma. Even if the male patient or a male partner of a female that has intraepithelial neoplasm, she can get him to be infected with the same type of virus. We have risk factors actually that people can be more affected by the virus, like smoking, oral contraceptives, multiple sexual partners, early coital age. Also, it's a common disease actually, and in different places in the world it's present, and occurs both in males and females. And also the age ranges from about 17 to 33, or the peak actually in the 20s, 20 to 24. That can happen more in this age. The clinical picture that we see, first we will talk about the history, because usually the patient comes with painless bumps, sometimes with pruritus, sometimes with discharge. And also usually they come with a positive sexual contact with a person or infected partner within 3 months. Also it is usually multiple lesions and in multiple places rather than only one single isolated wart. And sometimes the patient has the history of other sexually transmitted diseases, either previous or current, and history of anal intercourse, especially with perianal lesions. And also sometimes patients come, but rarely, with urethral bleeding or urethral obstruction. That is very rarely if the condyloma affected the meatus, and also sometimes vaginal bleeding. And also very rarely he comes with a urethral bleeding and urethral obstruction. Also sometimes there is vaginal bleeding and coital bleeding. Vaginal bleeding during pregnancy can happen if there is a large condyloma. Regarding to physical examination, there is either single or multiple, usually multiple, papillary eruption that could be pearly, filiform, fungating, or cauliflower. And it could be smooth, especially in the penile shaft, or verrucous or lobulated. Usually the site is multiple, and as we said, and in male penile, like the glands and the shaft, and in female, like vulvovaginal and cervical. Sometimes it's urethral or mucosal. Now, the color usually it varies from skin color to erythematous color to hyperpigmented coloration, and there is perianal also. Search for perianal lesions because, especially in immunosuppressed patients with anal intercourse, and also search for other sexually transmitted diseases like ulceration, adenopathy, vesicles, and discharge. Note also that there is subclinical infections, and sometimes it is hidden by the hair or in inner aspect of uncircumcised. What investigations do we do? Actually, we depend mostly on the clinical examination and the history, and but sometimes we consider some investigations in certain cases. Like also we can consider investigations for other sexually transmitted diseases as gonorrhea, syphilis, HIV, and condylo, and chlamydia, and others. Sometimes we need a pap smear, or sometimes we need a biopsy or other investigations that will be indicated by your doctor. Review of the treatment. Actually, there is the ablative treatment methods like the cryotherapy, which is a spray or cotton-tipped application for 10 to 15 seconds on the wart, and repeat as necessary. Also, it is safe in pregnancy, and but sometimes it causes pain, erosions, ulceration, and post-inflammatory hypopigmentation. Actually. The cryotherapy, as we said, is safe in pregnancy. Also, there is the electrodesiccation and curettage. There is surgical excision, and there is laser, CO2 laser application can be done, as well as immune-based therapy, acid application, interferon injection, medications that can be used at home like imiquimod, Aldara cream, podophyllitoxin, 5-fluorouracil, as well as other keratolytics, and don't forget also about the vaccination.